Good evening, Black people and all allies fighting for Black liberation, Black prosperity, and Black joy. I'm Laverne McGee in for Charles Blow, and welcome to Prime. America is on edge tonight. Coronavirus cases are rising across the country 1 week before the Christmas holiday. The U.S. is averaging over 120,000 new cases a day, with an explosive surge in the Northeast this week, according to data from the New York Times. Hospitalizations have also spiked 40% this month, according to reports from the Department of Health and Human Services. States along the Northeast have seen the biggest increase in hospitalizations over the past 2 weeks, but the outlook has been particularly dire in the Midwest and the Southwest. An ICU nurse at an overwhelmed hospital in Michigan told the New York Times, quote, "You come back to work and ask who died." With experts warning of a viral blizzard headed our way, many companies are pushing back their return to office plans. New York reported its highest single-day infections today since the beginning of the pandemic. Wall Street banks and investment firms are telling employees to stay home. After calling off all 4 days of today's performances, Radio City Music Hall announced this evening they will cancel the remainder of the Rockette shows for the rest of the holiday season. The NFL also made the unprecedented decision to move 3 games because of COVID outbreaks amongst players. For many of us who care about our families and loved ones, a familiar panic is setting in. What will this mean for my job? Will my kids have to return to virtual learning? Can I travel to see my relatives for the holidays? And most troublesome of all is this is part 5 of the never-ending pandemic nightmare. That's what people are perhaps thinking. Joining us now to discuss the latest is Dr. Corey Hébert, BNC's chief medical correspondent, and Mary C. Curtis, CQ roll call columnist and host of the Equal Time podcast. Welcome to both of you. Dr. Hébert, I'm going to start with you with your expertise. How worried should Americans be?
We should be very worried, Laverne. And the reason why is because at this point, we have a variant that's sweeping across the country faster than the Delta variant. Now, it's still questionable whether this variant is going to be as lethal. We don't know that for sure because people are talking about like it may be. But remember, the studies that we have were done on South Africans. And those South African people that were in that study were young. They were healthy. They didn't have any pre-existing illnesses. So they did very well. But when you come to America and everybody's overweight, diabetes, hypertension, especially Black folks, we're going to have a big problem. We have been steadfast at BNC saying, wash up, mask up, separate, and vaccinate. And those are the things that you must do. Now, one thing you also have to do is just remember that as we have done so many things to try to mitigate all of these infections across the country, the things that we did to try to decrease the amount of infection across, we're not doing anymore. We got extremely lax. We're paying attention to what the CDC says. And remember, the CDC has to do what they have to do for Wyoming to Miami to New York to Dallas, Texas. What our viewers must do is listen to the folks that care about them, which is BNC. And what we have said to Black folks is that you must wear that mask because we are the ones dying the most. And that N95 mask is going to be the thing that's going to protect you through this holiday season.
Yeah, you've been saying that since day one, Dr. Hébert. Now, Mary, we know the key difference between this year and last year, of course, is the availability of vaccines. About 1.8 million doses have been administered each day over the past week, according to the CDC, and more than half of those doses have been boosters. Mary, do you think we can weather this storm?
Well, we're going to have to, but so many people have been anticipating this year's holidays as a return to normal. And this is not normal, of course. It's uncertainty and it's hitting people where they live. They wanted to go to see their families, sports games, parties. What's going to happen in schools, what's going to happen at church gatherings. And there's this fatigue, but also the overlay is a political resistance because this pandemic has always been partisan. So when you talk about people lining up for shots, we see that in some counties, some of the red counties, there really is a disparity. That partisanship is the biggest factor determining vaccination rates. And so that is an added wrinkle to what the problem is going to be. So now we see that people want to go. The travel rates are higher than ever. And as the doctors say, will people be masking? Will they be getting vaccination rates? We see in some of the rising hospitalizations in these counties that some people who are going in are unvaccinated and still saying, this isn't COVID. And so that's another wrinkle that's going to really hurt as we try to get back to some semblance of what is normal. People have to get vaccinated. They have to get the boosters. And there's still some resistance to that, even as, though we don't know what's going on exactly with the Omicron variant, that it does look like it does spread faster.
Yeah, we keep saying going back to normal. I don't even know what normal is anymore. Most people can't even remember. And Dr. Hébert, I mean, we're hearing about sports teams canceling games, the Rockettes canceling shows, Broadway shows being canceled. This reminds me of when you and I first started talking about this in February of 2020. And now we're talking about Omicron. Is that going to become the dominant strain of the virus here in the U.S.?
Yeah, it will. Delta is still sweeping the nation as well, but Omicron is going to be the most dominant variant. And the thing that's going to happen that I'm really happy about is things are closing, and I know that we have to be very careful about the teetering of how we need to handle our finances in the United States. But we talked about that public health is a four-legged stool. You got public outcry. You have politics, you got money, and you got science. And of all those four things, science should be the most important leg, but it's not. And so as we see things start to close, I am all for a nationwide mask mandate and a nationwide vaccine mandate, because people are sitting at home saying they don't want to be vaccinated, they don't want to wear masks, they want to go everywhere. You can't have everything. And that is not what we need to be doing here. Right now, the science should rule the day. People that don't understand science are the ones saying all these things that are totally inaccurate. People saying that the vaccine is causing death. And what we do know is that this is a pandemic of the unvaccinated right now, meaning, granted, people can get COVID-19 if they have been vaccinated. We know that. But over 90% of the people that are in hospitals across the country right now are unvaccinated. And that is a fact. And so when we start talking about, my postman came to me the other day talking about he's not going to get the vaccine. I was like, dude, you've been my postman for 14 years. You can't even put the right mail in my box. You can't even read 4 numbers. You're talking about your research. I'm over it, right? So I now am saying, if you don't want to get the vaccine, don't get it, dude. But the problem is going to be, you're going to give it to somebody at that Christmas table where you're eating that macaroni and cheese, and that macaroni and cheese, and it better be accompanied by sweet potato pie, not pumpkin pie, Laverne. I draw the line.
Listen, I know you are serious about this, Dr. Hébert, so I hope your postman gets his act together and takes your advice, because we know how serious this is, and we know how, I don't know when people became so afraid of science or against science. It's a mystery to me, but there's a new CNN poll, and 4 in 10 Americans think COVID precautions are here to stay. So, Mary, does that seem accurate to you?
Well, I do think that while there is no appetite for lockdowns, that people are going to face reality. And we do see the appeals court, it is probably going to go to the Supreme Court, but the appeals court has given the Biden administration a win on their effort to have vaccine mandates and testing mandates for employers in businesses. And so there is an acceptance of that. Now, yes, they will go to the Supreme Court, but we also see a certain amount of hypocrisy, because some of the same politicians who are saying things like, don't believe in it, they themselves are getting vaccinated and getting boosters. So they are facing reality. And so I think that businesses will do this as well if they want the employees to come back and work. And so, yes, there will be some kind of modified mandates, because you have to get ahead of this.
So, Dr. Hébert, I want to clarify. I will have pumpkin pie and sweet potato pie. I need to clarify that first.
You are from Canada. You are from Canada.
I am.
Is
absolutely.
Anybody having pecan pie?
You can bring some, but I don't even know if we can get together. That's what I want to ask you, Dr. Hébert. Even if I wanted to invite you and Mary next week for the holidays, should I even do that? Should we be canceling our plans? Should we not be getting on planes? Should we not be visiting our loved ones for Christmas? Do I need to put my homemade recipes away?
Well, I will tell you this, Laverne, in all seriousness. If you have people that are around you that are very elderly, have pre-existing illnesses, are immunocompromised, I really wouldn't have those people around people that have been around in the general population, because even if they've been vaccinated, they could be asymptomatic and then bring that into the home. And then if you bring that into the home with a person who has been vaccinated, we don't even know. A person could have cancer and not even know, just like somebody like Colin Powell had multiple myeloma. Before he got diagnosed, if somebody walked around him with COVID-19, no one ever would have known, and he would have died sooner than he did. So the point is, what we have to do is just realize, just like we said last year, if you want Christmas to be right next year, do what I tell you to do this year. I said that last year, nobody didn't do it, so now we're here where we are now. Right? We got to do that, and there's no way around it. We cannot go around this. We have to go through it. It's hard, but we got to do it if we want it to be normal again.
Yeah, and I think
Yeah,
that
and
people have to
Mary, you
realize
did
this is
bring
a
up.
global, it's a global
Mm,
phenomenon.
yeah, it is.
No, no, you're right, Mary. And I was going to talk. You mentioned the partisan difference here. 91% of Democrats have received at least one shot, of course, versus 60% of Republicans. That's according to the New York Times. So, Mary, do you think this fifth wave is becoming an opportunity for more Republicans to get vaccinated?
Well, we see that a lot of the Republican, as I said, their leaders and senators and governors are getting vaccinated, and yet the message is they don't want these mandates. But it's going to be realistic, particularly since a lot of the health workers, as we know too, are getting so stressed out, and these hospitals are getting overwhelmed. So, yes, I think the message should be that no matter what the partisan divide is, believe in science. And so many of these people that don't want to get the vaccine, when they go to the hospitals, they want to have all this experimental therapy. And people are saying, well, you have all of these other experimental therapies and you don't want a vaccine? Come on.
Yeah, a lot to consider tonight as we deal with this wave that is about to hit us. Dr. Corey Hébert, thank you so much for joining us tonight. And columnist Mary Curtis, I'd like you to stick around and get your take on a story later in the show.